who is a patient. Do you know who is a patient? Good. Fantastic. Because today you go to a doctor, he says, take this pill. Sir, doctor, when I am all right, I can. No. Don't stop it. Blood pressure will go to the sky. Take it every day for the rest of your life. Finished. And very interesting message is, the Ayurvedic drugs which he tried, not from India, the Tibetan drugs, herbal drugs he tried, they were not having any one of these reactions. It goes inside and tags and gets digested, goes into the system, does good or doesn't do good, but doesn't harm and doesn't go to the liver. So the liver is, today we have an epidemic of what's called non-alcoholic cirrhosis, which I have never heard when I was a student in the 50s. Only alcoholics used to get cirrhosis. Now ordinary people, anybody goes to the doctor and says, slight touch of fatty liver. My God, I get about 100 and 150 consultations, free consultations, the email every day. Half of it is fatty liver. I went for a checkup. I have fatty liver. And for a change today, I had a Delhi University professor, senior professor, who wrote to me, Professor Hegde, I'm coming to 65. I have not seen a doctor so far. My wife pesters me every day, must have a checkup. Do you think I must have a checkup? I was so happy. I said, don't have a checkup. You are 65 because you didn't see a doctor. And you will be 100 if you are destined to be 100. If you go to a doctor, there's a good possibility that you will not see the 67th birthday. Delhi University professor, he said, I have kept my records roughly from the age 5, I remember, till today. I might have spent about 100 rupees to the doctor. Can you believe that? Delhi University professor, senior professor. I was so happy for a change. After a number of years, I am getting this. Everybody says, I have not had a checkup. I have not had a checkup. Somebody asked, did you have a checkup? I said, I have not had a checkup. But I don't tell them that. Because I always believe in Ayurveda. The Ayurveda has a beautiful definition of health. What is the definition of health in the Western medicine? 1947 Alma Ata definition. Absence of physical, mental, spiritual, emotional, environmental, this, that, disease. Which means it's a business definition, which was done with the business purpose. If you want to know you're healthy or not, you must go to the doctor. Which means you must go for a checkup. It's a good business, isn't it? See, checkup is the biggest business. You don't know that? Read this editorial in the BMJ called The Screening Industry. Screening Industry, written by the editor himself, Richard Smith. You say Richard Smith, BMJ, Screening Industry, it will come up. And the fascinating article where it shows that screening is very simple. You're all mathematicians, Pune, intelligent people. We don't have anything called normal in the human body. We don't know what's normal in the human body. We know average. Average everybody knows, but normal we don't know. So how do we arrive at the average? 1,000 people measure, let us say height, 1,000 people. And put a cow, Gaussian distribution like a bell. And we put the mean plus 2 standard deviation. I don't know what it means. It means mean. And that mean is transferred automatically into normal. What is the normal height of Indian male? 5.4 plus minus 2. 4.5 is also normal. 6.2 is also normal. But they automatically become abnormal. It's called false positive. So for every one measure that you do, you get about 25 to 50 false positives. Supposing you go for a checkup today, total body scanner, 500 parameters are checked. 500 into 25, don't want 525, 5%. 525 is 2,500, isn't it? 100 people go for a checkup, 2,500 patients come out. Based on this, a very intelligent professor of medicine in Yale University asked one of her students, who is a patient? Do you know who is a patient? Good. Fantastic. The student gave the same answer. A man or a woman who goes to the doctor becomes a patient. The professor was shocked. She was a good girl, 52, and she had done her studies very well. She got shocked. Then she asked the doctor, when does he become a man or a woman again? Do you know what the student said? Rarely ever, if ever. Because today you go to a doctor, he says, take this pill. Sir, doctor, when I am all right, I can. No. Don't stop it. Blood pressure will go to the sky. Take it every day for the rest of your life. Finished. Who is finished? Patient is finished. Drug company benefits. This is our practice of medicine. It's called reductionist science. You remember the bird coming in is cancer. And tablet going in is science. So this kind of a science, please, before I forget, none of you go home and stop your medicines. What I am giving is not the prescription, it's only story. If you want to stop your medicine and if you feel you're fine, please go back to your own doctor who has prescribed the medicine and discuss with him. No harm done. Ask your doctor 2 questions. Doctor, this pill you have given, no? What is the NNT of this pill? If your doctor knows the NNT, then you can talk to him. If he doesn't know, he has not heard the NNT, then no use talking to him. You ask him, what is the NNT, doctor, and what is the ADR? 2 things only you have to ask. Every tablet that he prescribes, there is an NNT, there is ADR. And if you don't know, don't worry about it. Right? But nobody stops at home. This one fellow wrote to me the other day. I heard your lecture in Bombay and I have stopped my blood pressure is normal. I stopped my blood pressure pill and I'm continuing to measure it's normal. But when I went to my doctor, he shouted at you and me together and he said, both of us are fools. I said, for no fault, you got one more enemy for me. So, because I didn't know who this man is, he heard my lecture somewhere. So after that, I am warning all the people, this is not a prescription, this is only an information. I am not your doctor, you are not my patient. Did you understand that? Okay, come back to what we were saying. Now what happens? You may wonder, what is this fellow talking about? We all get benefit when we go to the doctor, don't you? Whether he gives the drug rightly or wrongly, also you get benefit. Then investigations happened as to why this happens. 4 universities came into the picture like Bhushan. There's a professor of medicine in Oxford, very bright young man like Bhushan. He almost looks like Bhushan. His name is Professor Bingal. He had 4 universities, Oxford, Cambridge, Munich and one more university. So 4 of these universities did a study on tablets, drug effect on patients. What they did was, they took volunteers, produced severe pain in them. You can produce pain very easily. What is the best treatment for pain? Best? Huh? Pain, all are killers. They are not painkillers. What? No. Best conventional treatment. Morphine. Paracetamol won't kill the pain. Aspirin doesn't kill the pain. Aspirin kills the man. Morphine, you agree? Anybody doesn't agree? Everybody agrees? No, they gave a morphine drip to the patient. But told the patient, this is not morphine. This is a new vitamin we have found out, vitamin B17, lateral, which will cure your disease, may not take your pain out. Would you believe 88% of the people with the morphine running intravenously did not have pain relief? Did you mark my words? Then they crossed over. The same patient took the other side, produced the pain, started a saline drip and told the patient, this is the latest salt of morphine. Very, very effective. Your pain should go like that. And everybody's pain went. Did you get that? Then the researchers were nonplussed. What's happening? Then did a concurrent fMRI and repeated the whole study again. Do you know what it showed? When the patient believed, mark my words, believed his doctor and had faith in the doctor, their brain slept. Nothing happened. Pain didn't go. When the patient believed the doctor, the forebrain started functioning so powerfully that it produced very powerful opioids which killed the pain. In short, your pain relief or your disease relief comes from your own body. That's what Bhushan said a little while ago. Your own